My name is Novelet Spence. I am a clinical social worker at the Ayer Comprehensive Epilepsy Institute. Today, I want to take some time to speak with you about epilepsy-associated psychiatric disorders. Psychiatric disorders are 2 to 3 times more frequent in people with epilepsy than in the general population. Of all psychiatric disorders, depression and anxiety are identified as the most prevalent and serious disorders in people with epilepsy. In fact, approximately 20 to 50% of people with epilepsy will develop these disorders, compared to the general population, which is estimated to be about 7 to 20%. Depression and anxiety are associated with poorer quality of life, increased health utilization, and may also affect medical outcomes such as poorer seizure control and increased side effects associated with anti-epileptic medications. Overall, these disorders are found to have far more influence on the quality of life than direct epilepsy-related matters such as seizure type and frequency. As a result of these symptoms that can rise to clinical significance, it is important to understand, detect, and manage these psychiatric comorbidities in people with epilepsy. Let's take a look at some of the symptoms associated with these disorders. In depression, there is feelings of sadness, tearfulness, hopelessness, loss of interest in things once found pleasurable, lack of or decrease in energy, frequent thoughts of death. It is important to note that in people with epilepsy, suicide is one of the most common causes of death. In anxiety, there's feelings of restlessness, nervousness, or on edge, excessive fears about seizures, difficulty concentrating, sleep disturbances, and irritability. Managing psychiatric disorders begin with acknowledging the symptoms you are experiencing. Speak to your medical provider about them and adhering to any recommendations made for mental health treatment. Here at the Ayer Comprehensive Epilepsy Institute, we recognize that the management of epilepsy is not only about controlling seizures, but that it also depends heavily on detecting, diagnosing, and treating psychiatric comorbidities. This is done through consultations with our multidisciplinary team to partner with our patients with only one hope in mind. That is to help people with epilepsy maximize their overall quality of life. Stay tuned to hear more about epilepsy from another member of our care team.